I'm a consultant breast surgeon at Ahmedabad. I have my breast clinic called Samved Breast Clinic in an area called Naurangpura in Ahmedabad, and we just do focused breast patient. It was a gradual transition kind of a thing when I started my practice as a surgeon, and there were a lot of women who came with breast cancer, and they came in a pretty advanced stage to me, and that was what touched me the most, and I was a little shaken up because it was these women who needed a lot of help, a lot of awareness needed to be inculcated in our women, especially in the rural area. Of course, a lot of women in the urban area also had that issue that they came in an advanced stage. So that was the triggering point in my life that I chose that breast cancer is the field which needs maximum involvement from my side. Sacrifice is something which the word I don't agree to most of the times, because I think when we take up medicine and when we take up especially a surgical line treating cancer patients, we have to completely dedicate our lives and see it with a different angle. So I think it's part and parcel of the whole package that we have taken up as a profession, as a work, and as the time that we are going to commit to. But yes, of course, there has been a lot of support. I think it's my passion. And it's my utmost desire that I should be able to help each and every woman to screen herself, to get herself checked up, not only in the urban areas, but to the peripheral places of the surroundings of the city where I live. And we do that kind of work also. And once a patient comes to me and the patient goes away with a smile after the treatment, that gives me the biggest satisfaction. My daughter is a surgeon in making. She is in her final year and she'll be a surgeon very soon. And she has chosen to be a breast surgeon, and she'll be going ahead for her further fellowship in breast disease and breast cancer. So I'm very proud and happy that she has taken up the same line and she's going to follow the same dreams that I have seen. It's always a difficult balance to make between your work, your family, your home, and a lot of other things that you want to pursue besides your work. But I think if you time the things out well, if you know what you want to do and then plan your day accordingly, or plan your not only day but the days to come, if you plan them well, I think it should not be a problem. Of course, the family support, as I said, is very, very important, without which it cannot be done. I have never imagined myself or never thought of in my even the wildest dreams that I could be doing anything else but be a breast surgeon. You have to be very compassionate with the patients. You have to give time to the patients. Counseling is a very, very important part of your consulting. And I counsel myself, and I have my team who counsels the patient, because it is important to give more than the surgical part we are going to take care of, but it is very important to give a mental and a psychological comfort to the patient. I think what I would suggest that what they should ask their doctor or an oncologist is what would be the best treatment for that particular person, that particular stage, or that particular woman having that particular disease. And the doctor should give the best treatment. I think that is the only question that should be asked to the doctor. still, yes, the society is definitely a little gender biased. It was more when I started practice, so there were a lot of struggles which I had to go through as a woman, fighting against the male practitioners. But now I think the times have changed. So a lot of when I started my career as a surgeon, when I was studying, there were hardly any women who had taken up surgery, because it was a lot of hard work to be put in, a lot of compromises in the sense that you have to put in a lot of hard work. You need to have a lot of physical and mental stamina both to perform surgery, especially in cancer patients. But now the times have changed, so therefore I said no, because a lot of women, a lot of girls are taking up surgery as their career. As I said, my daughter has also taken up after seeing me, and I see her also to be quite dedicated. So I think the bridge is the gap is getting smaller and smaller. Today there are less challenges because now there is more and more of equality between men and women. Everyone, even the males, have started accepting that surgery, if women are equal to men in a lot of fields, and even in the surgical field. The girls and women who have taken up surgery, and if they are going to take up breast surgery, that the only thing which is required, any field that you take up, but if you are a surgeon especially, you should have a complete passion, dedication, and complete involvement with your patient. Financial gain should not be your goal. Money always follows. It's your dedication which is more important.
Just when we hear the word cancer, the first fear is, okay, I will die. She was the one who consoled me, okay, no, it's not a matter of death or life. We have to fight. And within 24 hours, I got a spirit along with Shefali and my family. Okay, no, I want to fight. So, I mean, it was a selfless attitude towards me, a love towards me, and a care for a patient. Okay, that makes, that gave our family a confidence to deal with the disease. And we planned my surgery like within 4 days of diagnosis. All for me, I have me as a patient, and I can smell that she has done that sacrifice for all her patients of breast cancer, and she has brought awareness in the society a lot.
कि बहुत पोलाइटली हमसे बात की, सारी सिचुएशन को समझाया, पेशेंट को उन्हें अच्छी तरह से देखा, उनकी मेंटल हेल्थ के बारे में सब बताया, और फिर हमने प्रोसेस अगर शुरू की थी, रिपोर्ट और वो सब करवाए, उनके बाद सर्जरी प्लान हुआ, और वो काफी अच्छा एक्सपीरियंस था उनके साथ, वो बहुत अच्छे हैं, वो कभी भी हमें आंसर देते हैं, हमें कोई भी दिक्कत होती है, एट प्रेजेंट अभी भी हमें कोई दिक्कत होती है तो वो रात को भी हमें मैसेज करते हैं, वो अपनी पर्सनल स्पेस, अपनी पर्सनल टाइम को सेक्रीफाइस करके हमसे बात करते हैं, मैं मैसेज करती हूँ कभी भी वो रिप्लाई करते हैं, अभी भी वो हमसे फोन पे भी बात करते हैं अगर कोई भी उनके बारे में दिक्कत हो तो. It's a wonderful experience about Dr. Shefali.